President Obama addressed health care in America once again today. The first part of the reforms go into effect tomorrow, and a lot of Americans are still unsure of how it will impact them.
All these things are designed not to have government more involved in health care. They're designed to make sure that you have basic protections in your interactions with your insurance company.
The administration's Patients' Bill of Rights passed Congress and was signed by the president 6 months ago. Now some provisions are kicking in. They include capping of lifetime limits on people already insured, requiring insurers to cover children with pre-existing conditions, and allowing children to stay on their parents' insurance until age 26. The health care reforms also change how some pay for over-the-counter medications.
Well, you may want to stock up on common drugs if you have a health savings account. Jake Peterson has more on the HSA changes.
Well, guys, a healthcare savings account allows you to put money aside for a doctor's visit, prescriptions, and common drugs like aspirin. It's all pre-taxed, but soon you'll be paying more or be paying out of pocket for some of those expenses. If you don't have a healthcare savings account, you're paying out of pocket for over-the-counter medications. But if you're like Cheryl Kelly, you have a fund set aside for those minor aches and pains.
Yes, I put most everything on it that I can.
Kelly is one of 8 million Americans who invested in former President George W. Bush's HSA plan. She puts money into a pre-taxed account. Kelly can use those funds for all sorts of medical expenses, including buying aspirin.
That's what it's for. That's what I put those tax-free dollars in there for every month.
But starting in January, she won't be able to put that aspirin on her HSA unless a doctor gives her a prescription.
Now we see a lot of HSA plans.
Pharmacist John Schaefer says the change will start affecting pocketbooks. He says many customers put common drugs on the same HSA bill as their prescriptions.
We could still process their prescription on their HSA, but the over-the-counter item, they're going to have a different form of payment.
And that's why people like Cheryl Kelly plan to raid the medicine cabinet before the changes take over.
It's just another thing that's a concern with our healthcare system to me.
And again, you can still put over-the-counter medications on your HSA for the rest of this year. Now, insulin is one of those items that will not be affected by this change. We're in the newsroom. Jake Peterson, NBC Action News.
And again, many health care mandates take effect tomorrow. And tomorrow night at 10, we talk with the experts about how your health insurance could be changing and cost you more.